This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle live right now on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. Live in studio, 888-630-9625, 888-630-9625. That's how you find me. Here in studio, I'd love to talk to you on any subject that you have in mind. Perhaps you've had a problem. You know what? You've tried. You've looked under every bush that you can. Well, here's an opportunity. Let's put the fire out and see what we can do without drugs, without surgery. Boy, we had a snow yesterday. It was interesting. We should have had a Christmas time. It would have been very, very pretty. But you know what? It's 40-plus degrees outside already, and it's melting, and life is good, and spring is very close. It's only a couple weeks away. So hang in there, my friends, because life as you know it will change. And change it will, no matter what the situation is. And we're going to talk about several things. Remember I said when, I don't have a guest, we're going to talk at least for a couple weeks about that 6-inch space between your earlobes called your brain and how it relates to the rest of your body, the nervous system, and how it makes things work and sometimes, unfortunately, doesn't work the way you want it to do. Well, we're going to pick that up again today and answer your questions. But I want to remind you, many of you know that we canceled the allergy class last week at the Roselle Center for Healing. Why? Because of the weather. So you have another opportunity. This Wednesday evening coming up, this Wednesday at 7:30 p.m. at the Roselle Center for Healing. If you have any problems with springtime allergies or fall-time allergies or any kind of allergies, this is an opportunity for you to find out what you can do to fix them and probably fix them permanently. Dr. Matthew Adams will be your host, your presenter at the Roselle Center for Healing. All you need to do is call our office at 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to attend. If you'd like more data, go to rosellecare.com. That's our website, rosellecare.com, and check it out. But show up. I promise you, you'll walk away with information that'll make a huge impact on how you tread through the spring. Remember, it's cold right now, and you're freezing. You're trying to stay warm, but then many of you will be going into all kinds of allergic reactions within the next few weeks as the weather breaks and things start happening. But now's the time to be able to fix that. So this is an opportunity for you. It's a absolutely no-charge event. We do require one thing. We require a reservation. So call 703-698-7117 this Wednesday evening. We'll mention again later on as we go through the program. Let's talk about you. Let's talk about some of the things that you need to know about. And so, where do we start? There's some good news and there's bad news. I always read journals and people throw things at me, and trying to keep up with the mounds of things that I have to look at sometimes is overwhelming. So I kind of cherry pick things and, things that sometimes support what I've been telling you for a long time, and sometimes things that don't support what I've been telling you for a long time. But this situation, it's the good news and the bad news. And what do I mean by that? Well, it's on the topic that we're going to discuss a little bit about today. So brain-body patterns, right? Neurocognitive dysfunction, neurocognitive problems, and things that you can do something about. Well, there's an article that said that a new set of research has successfully grown brain cells, neural cells, and that in a laboratory setting they duplicated the course of Alzheimer's. Well, that's great because now they can see the unfolding of things, right? And they're saying that this will enable the manufacturers of different medications to find drugs that will help Alzheimer's. Well, on the surface, that's great news. I think that's a wonderful thing. See, the current model has tremendous limitations and impedes research. What does that mean? That means that they actually have to get approval and make sure that this stuff doesn't hurt you. Well, supposedly, but that's not the case either. We can talk about that at a later date. But what they've done is now they can grow these things, and they've taken samples from human brain cells and these areas called glial cells, and they put them into these petri dishes, a little more sophisticated than that, and they begin to develop the actual brain patterns and then saw the unfolding, if you will, of the plaquing and the coils. They're known as tangles. They're kind of all screwed up, and that demonstrate the features of Alzheimer's. And then they're able to use drugs to reverse the process or stop the process or some way, interfere with this negative process. So they're saying that, subsequently you're going to get cheaper and faster drugs and things get on the market much more rapidly. That's the good news. So do you know what the bad news is? One of you already probably 10 steps ahead of me. The bad news is simply this. They are not taking into account what these drugs will do to the rest of your body. Your liver and your intestinal system and your heart and your lungs and other pathways, that can kill you, that can cause cancers, that can destroy your capacity to have quality. So we have to take the good and the bad and look them together and ask the question, is this process more supportive or less supportive? Am I willing to take the risk? Am I willing to take a medication that really hasn't been tried in humans, hasn't been really tried even in a laboratory animal, let alone a dish of cells? I don't know. I have my reservations. You know what they are. I think that you need to be very aware and ask questions along the way. So there's other things that are coming out. There's arthritic drugs, right? So they finally came out to say to you some of the things that I've been saying for a long time. And this was from the Journal of Neurology, and it was an interesting study. And it said that many of the medications that you're taking for arthritis may increase your risk of dying of a stroke. Well, a stroke and heart attack and things of that nature. They forgot to add that piece, see. And what they're talking about are these drugs called Cox-2 Inhibitors, and there's lots of them out there. If you want to check them out, probably half of the ones you're taking if you're on an arthritic drug have one or many of combinations of these things. And this was done in a university hospital in Aarhus, Denmark. Not even in this country. Interesting when they do things overseas and they end up on our news because they're smarter than we are half the time. And they found that evaluating 100,000 people from 2004 to 2012 that the problem was that 19% of these people that were taking these medications were much more likely to die of a stroke than those who don't take the drug at all. And the medicines, 42% had an increased risk of mortality across the board. Interesting. You sure you want this stuff in your body? Remember Celebrex? They took it off the market, 500 milligrams, because it had a really interesting side effect. It's called death from heart failure. I mean, no warning, boom, you're done. Well, what we know is what we've been talking about a couple of weeks ago is that it affects the mitochondrial function by depleting the body of something called CoQ10, coenzyme Q10. And now, suddenly, slowly, if you look through the journals, you're seeing all these little things being released subtly that, oh my God, yeah, these things do kill you. And see, the problem is that most of these arthritic drugs are given to older people because you've been complaining about your joints for so long, and now they'll so take this and let's see what happens. And in the light of the new Affordable Care Act, basically canes and drugs are your drug of choice and treatment of choice, right? So here's the deal. If you take this stuff long enough and combine it particularly with aspirin at any level, you dramatically increase your risk of death. And because you're older, what do they call it? Old age. And they don't tell you that there's that side effect. Interesting. I, for one, unfortunately know the problem. And I understand with the situation. Then years later they came back out, with Celebrex, they came back out, and instead of 500 milligrams, they came out with 200 milligrams. And they thought that would be better. But how many of you with 200 milligrams of Celebrex also take aspirin or any other NSAID, non-steroidal anti-inflammatory? Well, if you do, you're just adding to the soup. It's a problem, and we're going to talk about that. So many things that I'd love to sit here and just kind of call your attention to, but we do have things that we need to talk about. And one of the things, going into the neurocognitive patterns and function or dysfunction, if you will, there's a tremendous amount of money that's being poured at this subject. Why? Because people are showing that as soon as they have a head injury, like playing football or soccer or smacking their head into the wall after a car accident and any of those things, that they have significant cognitive impairment, sometimes immediately and sometimes over a period of time as the tissue begins to die and break down and degenerate. Well, you have to look beyond the veil, so to speak, and really understand, is it just due to impact or is it due to other things? Neurocognitive testing has been developing now for a lot of years. So some of the most significant research was published back in 1999, a guy by the name of Lupin, and it's moving forward now, and there's a lot of other stuff on the table. But here's the situation, is that years ago, there was a group of researchers that actually predicted that neurocognitive problems were very sensitive to changes in something that we've talked about for a long time called the HPA axis, hypothalamus pituitary adrenal axis, and functions in memory and vertebral cognitive patterns, meaning you can't remember the words, just like I'm doing right now. I'm struggling with the words. No, not really. I'm just trying to put this together for you. The primary neurocognitive battery of testing was one that looked at those things, albeit other areas as well. So what did they do? They looked at things like spatial orientation. Spatial working memory tests is what they call it. And this is computerized testing of working memory that looked at the ability of the subjects, if you will, to be able to locate different things in boxes. So they would put tokens in different boxes. They would put objects in different boxes, and they'd mess them all up, or they'd put them in there, and then you'd have to remember where they were. So if the token is never located in the same box more than once between different search areas and so forth, that was a finding. There's auditory verbal discrimination, and basically with can you figure out what's being said? Do you have good hearing? Can you listen to the music of today and know what they're saying? I can't. I don't know about the rest of you, but that's my problem, not yours. And my godson and my grandchildren, everybody tells me that I'm old and my brain doesn't work and so forth. But that's part of the problem. The brain begins to degrade because of its stress patterns, and you can't filter what's being said as easily as you can, things that are attached to your memory. That's why many of us like to go back and listen to the old music, because not only is it slower and easier to be understood, the articulation is much more specific, but we've also got it hardwired in our brains. We remember it. All you got to do is remember the music, and all of a sudden the words come out. That's part of it. And the compression of language today is everything's faster, whether you're on a computer or anything else. So short-term memory span also is another test that they looked at. So they were tested both on spatial domains and a lot of the auditory patterns as well. And what they wanted to see if there was an increase in length of sequential patterns adding onto things before there was significant consecutive failure, meaning that the more you loaded up the system, the faster your brain would begin to dysfunction. So if they did that to me, I'm going to dysfunction a lot because Sue says I just have a whole lot on my brain. I think that maybe there's, I don't know. Anyway, but these are the things that you have to look at when you're taking the ability to evaluate a patient that has either been injured, and we're going to talk about that HPA axis as we go through today, because it's an important piece of this whole neurocognitive damaging situation that happens not because of injury, if you will, but because of day-to-day stresses and our exposures and so forth, from drugs that we take to the steroids that that we're exposed to. And you're exposed to lots of steroids, even though you're not taking them because they're in your foods. Remember, it's against the law to export U.S. agricultural products into Europe and to Canada and to the Caribbean. It's against the law. That should tell you something about the quality of stuff that they're feeding you, my friends. We'll be right back after a couple very important messages. Don't go away. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. Indeed, I'm in studio. 888-630-9625. That's how you find me here. Give me a call. I'd love to talk to you about anything that you have on your mind. We're going to go to the phones, but we also have lots to kind of tweak your brain about today, because that's what we're talking about. We're talking about brain neurology and function. George, thank you for your call. How can I help you, sir?
Hey, Dr. Roselle. Always a pleasure to talk to you.
Thank you, sir.
Two comments. One is on your Celebrex, and I have to say I'm an older guy. I lift a lot. We've had conversation before. I have to say that that's probably the best illegal drug that they ever made legal, so much so that I had to stop taking it. I was taking probably 4 pills a day, 6 pills a day, but I have to tell you, the stuff worked.
It does work. There's no doubt about that. It does work. The problem is two things with it: is the side effects, and the heart function is only one of them. It goes on. If you look it up, there's huge side effects. The second thing with Celebrex is the problem that it causes joint degeneration. And so as an athlete, this is something that any NSAID is something that can be a problematic situation for you. Let me explain why. What happens is any of the NSAIDs, Celebrex included, competes for something called sulfate ion receptor site within the joint. The sulfate ion, because that's where you hear, glucosamine sulfate and so forth, that's what helps repair the joint. Your body produces a lot of this naturally. So subsequently, what takes place is that you get the NSAID, Celebrex or anything else, it goes in, it binds with that receptor site, it does something by decreasing the inflammatory response in that joint. So that's why it works. And then, but the problem is long term, it enhances the localized degeneration. And that's really the problem. Besides,
well,
go ahead.
I have to tell you, I had to stop taking it because it's something that good, and I trained really hard, and I had no pain afterwards. And you have to have the pain as an athlete to know where the injuries are and whatever. My second comment is, and I'm sure there's a lot of older guys listening to your show that want to know this, and they're curious about it. The additional testosterone that a guy can take, say when he's over 60 and he's extremely active. I've had friends take it, and they say nothing but good things about it. I haven't heard anything bad about it. They look great. Their fingernails seem to grow. They're lifting good in the gym. They say that their sex life is increased. And you see a lot of this in the magazines where they have this 100-year-old looking guy there in his face, and he's got a 20-year-old body.
Absolutely. So here's the deal that you need to know about with that, George, is that what you have to be careful with any of these things. I'll remind you of a guy by the name of many years ago, because you're probably the right age, Lyle Zadel. Remember him?
Oh, yes, very much so.
Okay, good. So he took all kinds of steroids, including testosterones, and boy ended up with cancer of the brain. And that's how he died. The problem is multifold. It will do the job by increasing your capacity, increase muscle patterns, providing that it converts properly. But many times what also happens, in addition to doing that, it converts into the bad estrogens, high levels of estrone and estradiol. When that takes place, your risk of cancers of all kind, including prostate cancer, dramatically increase. It doesn't happen immediately when you take the drug, but later on. But if you look it up, see what happens. But it has to be individualistic. You have to make sure that the liver's clean. You add that to a diet that may be somewhat toxic. You add that to a liver that can't metabolize this stuff. I'll give you another example. There's something called MTHFR, which means that the phase 1 of the liver cannot convert hormones properly, can't convert folic acid into the active form of folate, and there's a lot of things that build up on top of that. If that's a problem with a man, you can almost guarantee that they're going to have vascular problems because of the testosterone. They're going to have predispositions to cancers and so forth. So all I'm saying to you is that be very, very, very careful. It has to be monitored. It has to be kept within a very short range. At my age, I'm not touching it. I do other things. There's other ways of dramatically increasing your own production of things by keeping inflammatory responses down, making sure that your HPA axis is working the way it's supposed to, and so forth. So be careful. I know that it does what it's supposed to do. It decreases pain patterns. It decreases inflammation, so you're not feeling it. And if you're going to take testosterone, you have to make sure that those other pathways are clear.
Well, how would you test oneself to see, if you're I've had a testosterone test before. They said, well, you're within the normal range for your age, and I'm like, no guy wants to be within normal range of anything.
No, it's tissue. It's tissue buildup. So in our practice, we do some blood work when it comes to hormone levels, but we also do saliva testing. Why saliva? There's a lot of controversy. Saliva flows to blood. Blood is the pool. That's the amount that you actually have taken in. It's sitting there in the bloodstream. The saliva test shows you what's actually getting into the tissue that you can use use. And when we do testosterone, we're also going to do DHT, which is a bad testosterone. We're also going to do estrone and estradiol. We're going to do those other pieces to make sure that there's no slow buildup of problems over a period of years. And then all of a sudden, boom, how did I end up with this? So you have to get somebody who understands functional medicine protocols and not somebody who's just out there wanting to, and I know the advertising that you're talking about. There's this MD who's, they use him as the poster child. He's 70-some years old. He has a body better than I did when I was playing ball in college. And,
right.
It's that type of thing. But there's side effects to that. He is just one piece. There's other things that you have to be very aware of. George, send me a note, and I'll actually tell you the testing that you should do and, take it to your doc and see if they'll do it for you. Appreciate your call, buddy. Keep listening, and we'll try to give you as much data as we possibly can. We have several other calls that we're going to get to. We're coming up close to a break. 888-630-9625. That's how you find us. We're talking about the different brain patterns. HPA axis is what we left off on, and what that means is that hypothalamus, pituitary, adrenal. That's a necessary loop in your body if everything's going to work the way it's supposed to, from hormone production to thyroid function, your adrenal fight-flight system. If it fails on you, you're going to grow old very rapidly. You're also going to lose your cognitive capacity. You're not going to be able to assimilate information the way you want to. We'll get back and we'll talk about that after we break for the news. We'll be right back. Don't go away. You're listening to Dr. Tom Roselle.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live in studio. Give me a call, 888-630-9625. That's 888-630-9625. Love to talk to you. We're touching on a lot of different subjects, but I want to remind you, we rescheduled last week's allergy program, Springtime Allergies by Dr. Matthew Adams, and we want to re-invite you this Wednesday evening, the 25th, 7:30 p.m. at the Roselle Center for Healing in Fairfax. Just give us a call, 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to be there. We need a reservation. It won't cost you anything. We just want to make sure that we have room and we are prepared for you. It's one of those presentations that if you have any problem whatsoever with springtime allergies, and by the way, they're very similar to fall-time allergies and other allergies, if you'd like to find out really what to do with them and you're done with, all the nose dope and all the stuff that you're taking, this is an opportunity. Take advantage of it. Give us a call. Show up Wednesday night, and I think that you'll be pleasantly surprised by the information that you're going to go away with. We're talking about neurocognitive problems and all those things that, you really don't know much about, trying to put the light on the subject for you because you really do have control. You have the capacity virtually to change anything. By the way, that's why I wrote my book, Ageless Health. Health is a do-it-yourself program. You are the captain of the ship. Make sure you understand that. Sissy, how can we help you?
I have a daughter who has a condition called dysautonomia, or POTS.
POTS, yep.
Is that something you have experience with? And if so, can you tell me what helps?
Yeah, I can tell you a lot of things about it. Unfortunately, I've treated way too many people over the years. It's a primarily female problem, although not exclusively, but the greatest majority are women. And, it's a stumbling block for so many docs because it shows up in many, many different types of symptoms relative to fatigue, orthostatic hypotension. What happens is the heart starts flipping around for no reason. All of a sudden it just starts beating out of somebody's chest, feelings of weakness. And you know the drill, but I'm going over them because of our audience. And it's a bugaboo for most traditional physicians because they don't know where it came from. And this is one of those things that you look at truly from structural, chemical, and emotional. You have to remember that everything in the body happens for a reason. It doesn't happen just because. But in this situation, when doctors look at these patients, they come in, you have the audacity to complain about something that I don't really know anything about. And, sometimes they write you off as being hysterical and, glib and so forth. Well, the problem is how they treat that. As you know, medically, they give you drugs to counteract the symptoms from things that will stop the blood pressure from crashing. They give you things that are anti-inflammatory. They give you antidepressants. That's the big deal. The Prozac and Zoloft and the Paxils and yada, yada, yada. So let's get back to, what we see in our practice. Anytime that you have blood pressure just dropping out, so you have that feeling of, when you change positions, you move your head, everything starts getting dizzy like crazy. It has to be part of what we call that HPA axis, primarily the adrenal system. Now, the blood pressure is controlled by a lot of different things. The adrenal is one. Then there's something called baroreceptors in the neck and head. And if they're altered in any way, if there's a constant neurological feedback that's not normal, then you can get that type of presentation. If the adrenal system is stressed over time, it's not going to put out a hormone called angiotensin. Angio meaning blood vessel, tension. And so subsequently, when you change postural patterns, the blood wants to drop out and you get that dizzy feeling. If the neck has been injured or the skull has been injured because of something as mild as the dental braces that are often put in young women incorrectly, that can cause a problem. It can, if you have a daughter that plays soccer and she hit her head with the ball, that can cause a problem. So you have structural injury that has to be corrected. If the dietary patterns aren't normal, again, and this is all checklist stuff, not necessarily I'm finger pointing at all. If there's a hypoglycemic pattern that is reactive, meaning that you're not necessarily going to see it on normal blood work, even with a challenge, but under stress patterns, the blood sugars drop out. That can cause a lot of these problems as well. So you have to look at all of that. You have to look at the loss of certain nutrients within the body, some of the things that we've been talking about, from taurine and coenzyme Q10 and so forth. That can also, in depleted state, that can be a problem. So,
Go
ahead.
Do you ever see this connected with allergies or the use of inhalers, that sort of thing?
Unfortunately, yes. Because what happens is most of those things are steroids. And the steroids affect this whole system that we're talking about, the adrenal system. And pretty soon, after a period of time, that fight-flight system is going to get beat up more. So now when you're exposed to any kind of stress pattern, whether it's emotional stress or physical stress or dietary insult or environmental insult, the body can't handle it. So it begins to react. Blood pressures drop. Inflammatory levels go up. The body can't sustain itself. Remember, we talked about CoQ10 being one of those things that fuel the energy system in the body. So yes, you have to look at all those patterns, and it can be supported and it can be helped significantly.
Okay. Well, thank you so much.
You're welcome. Thanks for your call. Appreciate it. 888-630-9625. That's 888-630-9625. That's how you find us here. And by the way, you want to find us off air, all you have to do is go to rosellecare.com. That's ROSELLECARE.com. Tell my staff that you want to talk to one of my guys, or send me a note and I'll answer it. You may have to give me a week because, with all the travel and so forth, but I'll get back to you. Make sure you do that. So, Ms. Bowman, how can I help you?
Hi, Dr. Roselle. It's a great show.
How can I help you, my friend? Good to talk to you.
My question, under my breast, it is very hot, and I feel heat in my ears too, around my ears, around my neck. Sometimes it goes to my head.
When did it start?
It's been a while.
More than 6 months?
It is.
Okay, so it can be for a lot of different things. Does it happen all the time, or does it happen when you're doing things specifically? Does it happen when does it happen when you change positions? Does it happen when you eat something?
No,
okay.
It's just there. It comes and goes.
Okay, so there's a lot of things that you would look at with this type of condition. You have to see what the blood pressure is doing in different postural patterns. You have to look to see if the blood vessels are being forced open at different times by different type of nutrients. For example, if you take anything that has niacin in it, which is vitamin B3, niacin is a vasodilator. It means it opens up the blood vessels, and you never know when it's going to happen. It just open up. You can get real hot, particularly in your upper extremities, sometimes throughout your whole body, your face, your ears, your chest, your arms, your hands, and then all of a sudden it'll go away, and then it'll happen again, particularly if you're taking a time-release niacin. That's one of the things that, go through if you're taking supplements. Take a look at that. There are medications that will do the same thing. Some of the blood pressure medications will do that. And
Currently, I'm not taking any medicine.
Okay. What kind of nutrition are you taking? What kind of vitamins are you taking?
Only vitamin D.
Just vitamin D. Okay, so then D. Yeah, like David. The only other thing that you would look at initially, all those other reasons for it, is that you would look at allergy reactions to certain types of foods, because.
Do you think, Dr. Roselle, I'm sorry, I have swollen lymph node. This is through X-ray. I learned it last year.
Are they large? Are they very big, or are they small?
One was there is small, but the bigger one. They took biopsy.
Can you feel them yourself?
No, I don't.
Okay, so it's without seeing blood work and without seeing what they look like, it'd be very difficult for me to give you an opinion.
They took one, the bigger one. They took biopsy. They say
it's benign.
Yeah, it's none.
Okay.
So,
again, very difficult to tell you what it is without knowing more about what the blood work looks like. Send me some information, and if I can help you go through it, I'm more than happy to do that. Just go to rosellecare.com. Bernice, how can I help you, dear? Good to talk to you.
I have a question. I have a son that wrestles in the cage. He hasn't this year, but last year, and before that for about 8 years. I want to know, what can I give him to prevent Alzheimer's in the future?
Get him to stop.
Yeah, I told him, but he loves it.
Yeah, that's the problem is the more that he gets his head in jeopardy, the more of an increased risk that he's going to have cognitively. The more damage that he does to the neural plates. So there are things that you can do, but I'd have to see other pieces of his blood work to do that. So off the top, CoQ10, coenzyme Q10, vitamin B12, the hydroxy form of B12, and you have to give 5 parts folic acid to 2 parts B12, and very, very high levels, high dosages. I would give him sources of anti-inflammatories because he's a fighter. I would do proteolytic enzymes. Those are digestive enzymes, but he has to take them on an empty stomach. You don't want them to act as a digestive aid. You want them to decrease the inflammation within the system. You want to give B complex, particularly B1, which will help maintain neurological transmission. There's other things that you would do, but I'd have to know more. But I would start with that, and I would encourage him that this is not something he should be doing long term, because the end product is when when you're in there fighting, and I'm assuming you're talking about cage fighting.
Yes,
there's tremendous amount of damage that can be done. I played football in college, played D1 for those years. I was a Greco-Roman and freestyle wrestler. I got into martial arts and so forth. Fortunately, I didn't take a lot of damage to my head until I had 2 major accidents after that. But trust me, I've done everything from low-energy light laser to acupuncture to tons of nutrients to try to get my head back. And Sue will tell you sometimes she doesn't think I've gotten it back, but that's neither here nor there. So, but those are the things that you can do, Bernice. If you have any blood work, send it to me. I'll take a look at it, and we'll go from there. Appreciate your phone call, hon. 888-630-9625, 888-630-9625. Any impact sport, regardless of what it is, has the potential, the capacity of injury to your body. You need to know that. You get a blow in the head and your head aches for a while. It's not just the immediate concussive problematic situation. You need to look at it long term. There's damage. Here's some things that you need to do. Put your hands out in front of you and hold them so they're not being braced, and so your palms are down towards the floor, and then act like you're playing the piano, but do it very, very fast, very, very fast, very, very fast, like you're tapping the keys. If one hand over the other or both of them begin to tire very quickly, or one becomes spastic, or it's not coordinated with the other, that's a sign that there may be some neurocognitive damage. I want you to stand up. Every adult should be able to do this. Look straight, stand, bring your knee up and stand on one leg. If you can't stand there for at least 15 seconds, you may have some problems on the side opposite the leg that you have raised. Meaning, so if you have your right leg up and your left leg can't hold you in position, it's your right side brain. If you do it oppositely, if you're standing on your right leg and you can't sustain that, and maybe your left side of your brain, those are all gentle indicators of that. If you're having problems with articulation, you may have another indicator that there's a problem. If you have problems with word finding, that is another indicator. If you have problems in putting things in the same place all the time, that may be another indicator. If you find that all of a sudden you can't sustain muscular activity, meaning doing things, and it's not because you don't want to, it's because your body just kind of says, I'm done, I don't want to do this. You're emotionally not tired, but physically you burn out. And I mean in a very, very short period of time. I'm not saying going outside for a half hour or so and then you're tired, you want to come back in, but all of a sudden you start and you can't do it. If you're breathing and you're kind of trying to get as much air in as you possibly can, those are another soft indicators. Are they diagnostic? No, they're not. But are they suggestive that there may be other things that you need to look at? Yeah. If you were in my practice, we would be taking another step and taking a look at these things. Remember that brain and spinal cord control everything about you, above, down, inside, out, from your brain to your spine, to the nervous system, to your organs and your muscles. If that system isn't connected properly, and if it starts in the brain, remember you have 22 bones that make up your skull, and they move. They're like saw-teeth little interdigitations. And as you breathe in and out, those guys move back and forth, in and out, microscopically, pulling on something called the dura, which is the lining of the inside of the skull and covers your brain, helps pump the spinal fluid up and down. If they lock, for whatever reason, you're going to have other problems. If the spinal system moves out of its position, particularly in the upper cervical area, cervical 1, the first vertebrae in your spine, cervical 2, the next one down, if those guys aren't in position properly, they can pull and torque on this covering, this dura we just talked about, causing an impairment of many different things. Many of your cranial nerves, the things that you don't even think about that run your body, from the vagus nerve to the nerve of facial expression to phonation to visual to hearing and so forth, all of those things come from the back of your head. And if you have imbalance in those areas, those conditions that we've been talking about can begin to manifest. You need to be checked. You need to see if there's a problem, and you can fix them. You know, if you're still breathing, you still hear my voice, we're talking about something that can be measurably improved and not just left aside. We're coming up to a break, and we're going to talk about a couple things that you need to be aware of, and many of you have forgotten and put it aside because you're programmed differently, meaning because of commercials. We'll be right back.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Attend Neck and Shoulder Pain with Dr. Leonard Poe on Wednesday, March 4th at 7:30 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live, as you do every Sunday at 12 noon, right on the dial that you're listening to right now. We're always here at 888-630-9625 on Sundays, and you can find us at 703-698-7117, especially since you're going to register for Dr. Matt Adams' presentation on springtime allergies this Wednesday evening, the 25th, 7:30 p.m. at the Roselle Center for Healing. Please join us if you have any problems. If you want to figure out how to really, fix this thing, it can be fixed. Show up. Don't be silly. Don't put it off and spend another year with all kinds of inhalers and medications and allergy shots and things of that nature, which makes things worse in the long run. Give us a call, 703-698-7117. If you'd like to send us a note, you can do that by going to rosellecare.com. That's ROSELLECARE.com. ROSELLECARE.com. Mary, how can I help you?
Oh, hi. I hope you can actually cheer us up. This is for a male that has frequent nightly urination, like every 2 to 3 hours, is exhausted, sleeps during the day because of that is discouraged, and the urologist says nothing can be done. The PSA is fine.
Okay, not so. So what happens, and what I've been finding with a lot of men, and this goes back to the prostate and the breast tissue being the same genetically, that they're going to have a much more sensitivity to estrogens binding to the prostate glands as they do to the breast tissue. And a lot of guys, as we get older, because of shift and all kinds of things, but dietary patterns and stress patterns and so forth, and our environmental exposures to estrogens, seem to have problems where PSA is not an issue, but they have to get up multiple times at night, so they're exhausted all day long. We've been using a natural Chinese herb. It's called Qi Herbs, but it's from Qi Laboratories. It's an aromatase inhibitor, and it seems to make a huge difference in combination with a couple other things that we do with patients. And what it does, it works on the receptor sites of something called interleukin-2 and TNFAs. And it also dramatically increases interferon in the body. But the bottom line is that because of the estrogen binding in the body, it decreases the testosterone and increases the estrogens and subsequently swelling of tissue. So what we try to do is reverse that, get the liver to start working again, decrease the accumulated estrogens within the body, use some of the herbs that protect the prostate and the neurology to the system, because you also have to look at the muscle that surrounds the tube, the urethra, that goes to the bladder to empty. This little muscle is called the trigon muscle, and there's nerves from the back that service it. There's some acupuncture channels that service it as well. But what we found is that you can make a difference if it's approached properly. But the good news is that his PSA is normal. The bad news is that he's probably got a buildup of estrogens within the body.
Can you actually help him? He also takes digoxin and Coumadin. I didn't know if that was an effect.
Yeah, it's going to, because it's going to affect all different types of receptors within the body as well, particularly talking about the things that we just talked about. It would need to know a lot more. Obviously, I can't prescribe. Don't know the patient, but there is help. There's things that can be done. Mary, thank you for calling. I appreciate it. This program is one that I could sit here all day and answer your questions. I'd love to do that. That would be great. And we try to give you that opportunity on a regular basis to have your questions answered, just like this Wednesday evening when Dr. Matt's going to be talking to you about allergy reactions at 7:30 p.m. at our office. Please give us a call at 703-698-7117. Go to our website at rosellecare.com. Check out the classes that we offer. They're there for you. We have in-house classes on just basic triad of health, structural, chemical, emotional, how they affect everything in your body, the things that we always talk about. You have to make sure that you take control of your life and of your health. Watch the foods that you're eating. Make sure you're getting some exercise. Making sure you're meditating or praying every day to calm your body. Use the time that you go from one place to the other to decompress in your car, and don't get so jacked up about everybody around there. Put some good music in there. Listen to something that's soft and gentle. Change the way you focus. Give gratitude. Develop an attitude of gratitude in everything that you do every day, and you'll find that your heart will meet up with your soul and you will relax. This is Dr. Tom Roselle. I'll see you next week. Bye.